This one vaccine could save you from cervical cancer. Hi, I'm Dr Manini Patel, obstetrician and gynecologist from Jaipur with over a decade of experience. And today I'm going to talk to you about cervical cancer, vaccination and pap smear. Now, what is cervical cancer? The mouth of your uterus is called cervix, and the cancer of that area is called cervical cancer. Now, how do we prevent this and how do we predict this? First, I will talk about prediction. Prediction is by pap smear testing, by which we can detect cervical cancer at a very early stage. Pap smear is a very simple test. You come to the OPD, it's a 5-minute procedure. You lie down, we take a simple test, we process it, and it gives you a prediction. The advantage of pap smear is that it will tell you about any infection, any abnormality other than cancer as well. Now, when should you get a pap smear done? So, pap smear is basically recommended from age of 21 years. Any woman who has been sexually active should get a pap smear done. It is done every 3 years, provided your previous pap smear was normal. You can also combine this with something called as co-testing, where a pap smear plus a HPV duo test is done, and if it turns out to be negative, you have to repeat your test after 5 years. The testing continues up to the age of 65 years. So, starting from 21 years to up to 65 years, every 3 to 5 years, you should get yourself tested for a pap smear. This will help you predict many things along with your cervical cancer. Now, coming to protecting yourself from cervical cancer. In the world, cervical cancer is the only preventable cancer, and there is a vaccine against it, which is called the HPV vaccine, human papilloma vaccine. What is this vaccine? HPV vaccine is basically against a virus which is causative agent जो cervical cancer cause करता है 90% of the times. This virus is called human papilloma virus, and the vaccine which has been made is HPV vaccine. So it has 2 doses in age group of 9 to 15 years girls. When you are above 15 years, you need to take 3 doses, that is 0 dose, 2 months and 6 months. The vaccine is most effective in 9 to 15 years age group. It is offered between 15 to 30 years also. Beyond 26 years, the effectivity of the vaccine is slightly reduced, and up to the age of 40 years, you should discuss with your obstetrician and then decide about the vaccination. But I would request all the mothers, all the girls, please do consider about taking a HPV vaccine. If this video has helped you in any way, tap a like so that more women get reliable information. For personalized care, visit my website or book an appointment. Subscribe and share so that every woman deserving stigma-free knowledge about her body can get connected. Stay healthy, stay confident.